I want to separate two things that get confused constantly. Belly fat and bloating are not the same problem. Belly fat is tissue. It accumulates slowly over years, and it does not appear overnight. Bloating is gas, fluid, or distension. It can come and go within a single day. They feel similar from the outside, which is why so much advice about them is useless. So today I'm going to handle them separately. 5 foods with the evidence for each. And I am going to be honest with you about something first, because it matters more at 70 than it did at 40. No food burns belly fat. There is no such thing as spot reduction, and there never has been. You cannot direct fat loss to a specific region of your body by eating a specific food. Anyone who tells you otherwise is selling something. What food can do is change the environment that drives fat storage, and that is a real and worthwhile thing. But I am not going to lie to you about the mechanism. And near the end of this video, I am going to tell you about a symptom that gets mistaken for bloating for months at a time with serious consequences. If you are a woman over 60, please stay for that part. Let me explain what belly fat actually is, because there are 2 kinds, and they are not equally important. Subcutaneous fat sits just under the skin. It is the fat you can pinch. Metabolically, it is fairly harmless. Visceral fat is different. It sits deep inside the abdomen, wrapped around your liver, pancreas, and intestines. You cannot pinch it, and it is not inert storage. Visceral fat is metabolically active tissue that releases inflammatory signals directly into the vein that feeds your liver. That is why it is associated with insulin resistance, high triglycerides, and cardiovascular disease in a way that hip and thigh fat simply is not. Now, here is what changes with age, and this is the part almost nobody explains. After menopause and after the decline in testosterone in men, fat redistributes. The body shifts storage from the hips and thighs toward the abdomen. This is why a great many people find their weight has not changed much, but their waistband has. At the same time, you are slowly losing muscle, which is your most metabolically active tissue. So you can gain visceral fat and lose muscle while the number on the scale stays exactly the same. Which brings me to something I want to say clearly, because it is the opposite of what most videos tell you. At 70 or 80, chasing weight loss can be dangerous. Unintentional weight loss in older adults is associated with worse outcomes, not better ones. When older adults lose weight, a substantial portion of what they lose is muscle and bone, not just fat. And losing muscle at this age means falls, fractures, and loss of independence. So the goal is not a smaller number on the scale. The goal is less visceral fat and more muscle. Those can happen at the same weight. If you are over 70 and thinking about losing weight deliberately, please have that conversation with your doctor rather than with the internet. Now, the foods. Number 1 is soluble fiber. Oats, beans, lentils, barley, apples, psyllium, Brussels sprouts. Observational research has linked higher soluble fiber intake with slower accumulation of visceral fat, specifically over multi-year follow-up. The mechanism has several parts. Soluble fiber slows gastric emptying and blunts the glucose and insulin rise after meals. And insulin is the primary hormone that signals fat storage. It is fermented by gut bacteria into short-chain fatty acids that appear to improve insulin sensitivity. And it increases satiety, so people eat less without deliberately restricting. I want to be careful here. That is association, not proof. And fiber is not a fat-burning agent. But of everything on this list, this has the most consistent data behind it. One caution, and it connects to the second half of this video. If you increase fiber quickly, you will bloat. Increase it over 2 to 3 weeks and drink more water alongside it. Number 2 is protein. And this is the one I most want older viewers to hear. Protein does 3 things that matter here. It preserves muscle, which is the tissue that keeps your metabolism from falling and keeps you on your feet. It has a higher thermic effect, meaning your body spends more energy digesting it than it does carbohydrate or fat. And it is the most satiating of the 3 macronutrients by a wide margin. Older adults need more protein than younger adults because the body uses it less efficiently with age, and yet appetite typically declines. That combination is why sarcopenia, the age-related loss of muscle, is so common. Eggs, fish, poultry, Greek yogurt, beans, lentils, tofu. Spread across the day rather than concentrated at dinner because the body handles it better that way. And protein without resistance exercise does far less. The muscle needs a reason to be built. If you have kidney disease, your protein target is set by your doctor, not by a video. If this is useful, tell me in the comments what you usually eat for lunch. I read them. Number 3 is fermented foods, and this bridges both halves of the video. Yogurt with live cultures, kefir, sauerkraut, kimchi. In a randomized trial at Stanford published in the journal Cell, 10 weeks of a high fermented food diet increased gut microbial diversity and reduced 19 inflammatory proteins in the blood. That matters for visceral fat because chronic low-grade inflammation and insulin resistance reinforce each other. And it matters for bloating because a more diverse microbiome tends to produce less gas from the same food. Start with small portions. If you add a large serving of sauerkraut on day 1, you will not enjoy day 2. Number 4 is water-rich, potassium-rich produce. Cucumber, celery, melon, leafy greens, tomatoes. And here I need to correct a common belief. Many people who feel bloated cut back on salt, which is reasonable. Fewer know that potassium is the other half of that balance because potassium helps the kidneys excrete sodium. Now, an important caution I have given before. If you have chronic kidney disease or take an ACE inhibitor, an ARB, or a potassium-sparing diuretic, you should not deliberately load up on potassium without speaking to your doctor. High potassium can cause dangerous heart rhythms. For healthy kidneys, this is fine. For damaged ones, it is not. Number 5 is ginger and peppermint, and these are specifically for bloating rather than fat. Ginger appears to speed gastric emptying, which helps the fullness that comes from food sitting too long in the stomach. Peppermint oil has reasonable clinical evidence in irritable bowel syndrome, where it relaxes intestinal smooth muscle and reduces cramping and distension. One caution on peppermint: it relaxes the valve at the top of the stomach as well. So if you have acid reflux, it can make that worse. Now let me give you the honest list of what actually causes bloating, because 5 foods will not fix a mismatch. Eating too quickly and swallowing air is extremely common and rarely considered. Carbonated drinks, sugar alcohols, which end in the letters OL, found in sugar-free gum, mints, and diabetic products, and which are a very frequent hidden cause. Lactose intolerance, which increases with age as the enzyme declines. So people who tolerated milk at 40 may not at 70. Constipation, which is the single most common cause of bloating in older adults, and is often the whole answer. Certain medications, including some diabetes drugs, iron supplements, and opioid pain medication, and swallowing air from poorly fitting dentures, which sounds minor and is not. Now, the part I ask you to stay for. Bloating that comes and goes after meals is usually digestive. Bloating that is persistent is a different matter. Ovarian cancer is frequently mistaken for bloating and dismissed as diet or as normal aging. About half of ovarian cancer cases are diagnosed in women aged 63 or older. Research has found that persistent abdominal distension, meaning daily swelling rather than occasional, is far more common in women with ovarian cancer than in those without. And surveys have found many women wait months from first symptom to diagnosis. The pattern that should prompt a call is bloating or abdominal swelling that is present most days for 2 to 3 weeks or more and does not come and go, especially if it comes with feeling full very quickly when eating, pelvic or abdominal pain, or new urinary urgency or frequency.
There is no routine screening test for ovarian cancer, which is exactly why the symptoms matter so much. If that describes you, please make an appointment, not to frighten you, and it is far more likely to be something benign. But this is the one where waiting has real consequences, and it is dismissed constantly. A few other patterns that mean a phone call rather than a diet change. Unintentional weight loss without trying, which is a red flag at any age and particularly after 60. Blood in the stool or black tarry stool. A persistent change in bowel habits lasting more than a few weeks. Difficulty swallowing. New abdominal swelling with leg swelling, which can indicate fluid accumulation from heart or liver problems. And bloating with vomiting and inability to pass gas, which can indicate a bowel obstruction and is urgent. 3 honest statements before I close. No food reduces belly fat directly, and the foods here work by affecting insulin, inflammation, appetite, and muscle. Most of this dietary evidence is observational, and this video is education, not medical advice. I am a physician, but I am not your physician. Here's what I would actually tell a patient in my office. The strongest interventions for visceral fat are not on this list. Resistance training twice a week is first because it builds the tissue that everything else depends on. Sleep is next, and short sleep is strongly associated with abdominal fat. Then reducing alcohol, which goes to the liver and is genuinely associated with central fat accumulation. Then not sitting for hours at a stretch. The oats in the yogurt are real, and they are worth eating. They're simply not the lever people think they are. And if you are over 70, please hear this once more. Muscle matters more than the scale.
A stronger 80-year-old with a slightly larger waist is in a far better position than a thinner one who cannot get out of a chair unaided. Tell me in the comments whether your bloating comes and goes or whether it is there most days. That distinction matters, and I would like to know. Take care of yourselves, and I will see you in the next one.